Speaking of rare diseases, I think this is particularly relevant to the area I work in. For example, myelofibrosis, not just prefibrotic, but myelofibrosis as a whole, affects about 4 to 6 individuals per 100,000 US population. So that's the prevalence, and this is a clearly a rare disease. Incidence is about one or less, per 100,000 per year. Other diseases that I work in, are not a whole lot more frequent either. I mean, granted, polycythemia vera and essential thrombocythemia, they have prevalences around 50 per 100,000, partly because the survival is a lot longer than in myelofibrosis. So prevalence increases even though the incidence is not much higher. Systemic mastocytosis is another great example. This is a disease where also something I do a fair bit of, is a disease where, again, the incidence is around less than 1 per 100,000 annual incidence. And then prevalence, of course, which is directly tied to longevity and survival in systemic mastocytosis, would be a bit higher because of the generally favorable outcome of those patients in terms of prognosis. But I think, to raise awareness of these types of entities, having commemorating something like Rare Disease Day is extremely important. I find that patients often reach out to others afflicted with the same condition through, social media, through advocacy groups, and that really helps because, it's not, these are not common diseases where, you might have a friend or an acquaintance with it, where, you have to sort of seek out individuals that have these. Although on a side note, MPNs can run in families, but again, I think supporting one another and which these advocacy groups and groups online, social media has really facilitated this. This is critical. They do a fantastic job. Sometimes, they will bring in experts to do webinars and things like that. I've done a few of those. In fact, doing one in a few days here. I think doing whatever we can to increase awareness of these rare diseases is really important.